As of June 13th, Halton has seen nearly 18,000 cases of COVID-19. This includes 124 cases that are active currently, and sadly, 229 deaths. This graph shows the number of new cases per day, broken down by whether they are known to be variant cases in green or non-variant cases in gray. The orange line on the far right indicates the most recent days of data when variant cases are likely to be underestimated because the results of mutation testing take a little longer to be reported. After reaching an all-time peak in mid-April, the 7-day rolling average has continued its steep downward trajectory. We're now seeing an average of about 19 new cases reported per day, which is much lower than our peak rolling average of 163 on April 17th. This decrease was likely driven down by the lockdown introduced in April, as well as the significant vaccination effort that has been underway in Halton and Ontario overall in recent months. Next slide, please. While the incidence rate of cases has been trending downwards for the past 2 months, it only very recently fell below the recommended threshold of 25 per 100,000 shown by the orange line. As of June the 13th, the rate had fallen to 20 new cases per 100,000 Halton residents. As a friendly reminder, this threshold was recommended last fall by the Ontario Science Advisory Table. At that time, they advised that when cases are above this orange line, people are encouraged to work from home, only leave home for essential activities, and restrict indoor activities where it is difficult to maintain physical distance and/or wear masks. Next slide, please. Variant cases drove the third wave of the pandemic, with over 70% of cases reported during most weeks in the third wave being variant cases. In the last 2 weeks, however, we have begun to see a decline, with just 46% of cases reported the week of May 30th to June 5th having a known variant. Last week was even lower at 34% of new cases having a known variant, though that will likely increase since it takes time after cases are first reported to receive the results of their subsequent variant testing. The decline in the percentage of cases who are known to have a variant does not indicate a return to the wild type COVID-19 we saw in the first and second waves. Rather, the decline is thought to reflect the increasing dominance of the new Delta variant, or B1617, in Halton and surrounding areas. The difficulty is that currently the routine PCR assay test that detects whether cases have a mutation does not have a precise screening test for the Delta variant, the way that we screen for the Alpha variant, previously known as the UK variant. Whole genome sequencing can detect the Delta variant, but only a subset of cases actually proceed for full genomic sequencing. Therefore, we are currently underestimating the number of new cases who are variant cases, and these missed cases likely have the Delta variant. Next slide, please. The diagram on the slide is taken from a June 10th presentation by the Ontario Science Advisory Table. They look to research from the UK showing that one dose of COVID-19 vaccine does not offer as much protection against the Delta variant compared to the previously dominant Alpha variant. However, vaccine effectiveness against the Delta variant improves notably after a second dose of vaccine. Therefore, the Delta variant expected to become the dominant strain in Ontario by early summer. The province has adopted the recommendation to accelerate second doses in areas at high risk of Delta, thereby keeping cases under control and preventing spillover into other areas. Halton is among the health units considered at risk of Delta, which is why Halton residents are eligible for second doses at an accelerated interval. Next slide, please. Similar to cases, the number of COVID-19 outbreaks in Halton has been trending downwards. As of June 13th, just 3 workplaces, 1 childcare facility, and 1 long-term care home in Halton have active outbreaks. This is similar to trends seen in other nearby health units. Next slide, please. We've continued to see a decline in COVID-19 patients in Halton hospitals, with 13 COVID-19 patients occupying beds in Halton hospitals as of midnight on June the 13th. 75% of COVID-19 patients in Halton hospitals were Halton residents, while 25% lived outside of Halton. Of course, we do not know how many Halton residents are occupying beds in hospitals outside of Halton, as hospitals throughout Ontario share the burden of COVID-19 patients. 50% of COVID-19 patients at Halton hospitals were under the age of 60. None of the patients across all the Halton hospitals were known to reside in a long-term care home. Next slide, please. These graphs show how this recent decrease in the incidence rate fits against the rise in one-dose vaccine uptake among Halton residents. On the left, early access to vaccination among residents aged 80 years of age and older in Halton, including early second doses for long-term care and retirement home residents, likely helped keep the incidence rate low in this age group, even during the worst of the third wave. On the right, residents aged 20 to 39 experienced a drop in COVID-19 incidence more recently, likely thanks to restrictions introduced in April, as well as increasing access to first vaccine doses for this age group. As mentioned, with the Delta variant becoming more common, it will be important to see two-dose coverage rising in all age groups to keep incidence low. Residents will also need to continue following public health measures until widespread two-dose coverage is achieved.